Trigger an all-hazard disaster plan.
Yes, ma'am.
Page the phone tree.
Right away.
28-year-old male, crush injuries, severed artery, massive blood loss.
Trauma 3 just opened.
Got a tourniquet on his right leg. Tried to intubate but couldn't get his jaw open. He lost his pulse on the ride.
Put him on our monitor and rapid transfuser. Grab 4 units of O-neg and start with the round of epi.
Already hit him with the epi times 2. Still no pulse. He's in fifth.
Let's get him in the bay. I got it from here, man.
Nope, he's mine.
Okay, who the hell is this guy?
Says he's a doc.
Get off the gurney, Doc. I'm senior resident in this ER.
Yeah, well, I'm your new trauma fellow.
Dr. Halstead.
Female, early 20s, head trauma, GCS 3, unresponsive in the field.
Trauma 2 just opened.
Still GCS 3. We gotta change that King airway to a formerly T2.
I'll get a line in the groin.
Where's your line?
Left AC, obvious femur fracture, good distal pulse.
It's blown.
Sweetheart, we're gonna take good care of you. You know anything about that?
Pretty sure her father was loaded, must have been sent to Sinai County.
I know, honey. Sweetie, look. See this lady right here? Her name is Maggie. She can find anybody, anywhere, okay? I promise she'll find your daddy for you.
Better believe I will, hon.
Hold compressions. You are?
Sarah Reese, fourth-year med student.
Can you do a course in the groin?
Mm-hmm.
Get a left femoral in there. There, you're sterilized. Now stick it.
He's a patient, not a pincushion.
I can't find the vein.
All right, shock to 120. Clear.
No pulse?
Again, 200. Clear.
I have a pulse. Sinus tach at 112.
And he's back. Get a BP and keep giving him blood. Send a rainbow of tubes and a type and cross. Get his blood gas and get him to the OR.
Yes, sir.
Did you find my dad yet?
We will, sweetheart. Don't you worry. All right, now we're gonna put something in your arm to give you medicine. It's just gonna be a little pinch, okay?
Make a fist for
Squeeze
me,
my
honey.
hand.
Make a
Look at
fist.
me. Squeeze my hand. We're gonna count to 3. Look at me. 1, 2, 3. All done. Good job. There you go. Let's get X-ray in here.
No gag reflex, didn't even need sedation. Not good.
We got another problem. This woman's pregnant.
There. You can see her feet and a hand. Everything looks good, Mr. Macedonian.
Well, thank you for doing this. We just needed to see her again.
She just squeezed my hand. I swear, I felt it.
Her reflexes are still intact. Movement can occur, but it's not purposeful.
She just did it again right when you wiped her stomach. She responded.
Tell me that wasn't purposeful.
Dr. Choi, let's get a repeat CAT scan. Sherry?
Dr. Halstead?
Need to blow down her CO2, take her off the vent and bag her, give her a dose of Manadol, and increase her dopamine drip to 12.
Right away. Doctor?
Gina's intracranial pressure is rising.
What does that mean?
You said that she was getting better.
Well, she is, and that her function was improving. But the swelling of her brain is getting worse.
We're gonna try to control it with medication. And what if the medication doesn't work?
Then she'll require surgery. The procedure's called a decompressive craniectomy.
Would that be dangerous to the baby?
There's always a risk for the fetus, and for the mother as well, so yes.
That's why we hope the medication does the trick.
Call me.
I'm Sarah Reese. I'm a fourth-year medical student. Dr. Manning sent me in to check on Rachel before we sign her up. This is for you.
Thanks. Oh, what's his name?
Why don't you give him a name? I need need to talk to your mom. About your husband.
What?
No, he's okay. He's still in surgery. The OR nurse says it's going well. As soon as we hear something, I'll let you know. Rachel? Rachel, can you hear me?
What is wrong? What's happening?
I can't find a pulse.
Oh my God.
Code blue, treatment 3. Code blue, treatment 3.
Little help here!
Code blue, treatment 3.
You're not compressing the heart, Sarah. You gotta go harder.
But she's so small, I don't want to...
Harder, do it. Let's go. Come on, Sarah, harder. Hold. There we go. Back inside us, get a BP.
What happened?
She arrested, we got her back.
I can't get an IV.
Hand me your drill, get an IO line. I got a line. All right, let's get her a CTPE study, then up to PQ. Mom, you can come with us.
Good job.
I just broke a little girl's ribs.
Reese, you saved the girl's life.
Her ICP is unresponsive.
Her CPP is 40.
Sherry, get me Dr. Abrams.
You're planning to do the surgery?
What about our baby?
The meds we've been giving Gina haven't been effective. Her intracranial pressure, the brain swelling, is getting to a dangerous level, and we shouldn't wait any longer.
I'm not sure we can consent to that. It's not really a matter of consent.
Well, actually, Doctor, it is. We have a surrogacy contract with Gina. A rider to that is a medical power of attorney giving us the right to make decisions on Gina's behalf.
I don't see how we can sign off on a procedure knowing it will endanger our child.
Mr. and Mrs. Donahue, Gina needs this surgery.
It's her only hope.
But it's not a guarantee she's going to recover.
No, but without the surgery, I can't guarantee she won't.
You would just allow her condition to worsen?
This is our child. What would you do to save your child?
Code blue, I see you. Code blue, I see you. Code blue, I see you.
I'll take over.
I see you.
Ma'am, I'm sorry. We need some more room.
Hold compressions. No pulse. Sinus tach. He's profoundly hypertensive. Amp of epi, max of dopamine, max of vaso.
You're gonna max him on pressures.
Don't have a choice. Pads.
Jorge's brain was without oxygen for too long. Pasó mucho tiempo sin oxígeno.
Dead?
Sí. Su corazón sigue latiendo, pero él ya no está aquí. I'm so sorry.
Miss Donahue, I'm Sharon Goodwin, Chief of Services. I know about your situation.
And you think we're monsters?
No. I think that you and your husband are faced with a very difficult decision.
We just wanted to have a baby. That's all. It's supposed to be so simple, so natural, and instead...
I understand.
We love Gina. But this is our last chance to have a child. There's no more embryos, no more eggs. What are we supposed to do?
You have to ask yourself what you can live with. How are you gonna feel a week from now? A month or a few years? Gina handed over her life to you in that contract. She trusted you to make the right decision.
What would you do if you were me?
I'd want to live up to that trust.
bleeding from somewhere.
Trauma 2. Get your asses over here. Who is she? What happened?
I don't know. I found her a couple blocks away, collapsed on the sidewalk.
Let's get her on the monitors.
April, you got this?
Got it.
Where's she bleeding from?
Working on it.
HR 130. BP's at least 90. I've got a radial
All right,
pulse.
get 2 lines.
On it.
Get an iStat ABG and send labs. Make sure we type and cross.
Can you hear me? Can you tell me what happened? The blood, did you get shot?
Let's get these wet clothes off for now.
Don't worry, we're gonna put you in a gown and see what's going on, okay?
Get blood, O negative, make sure it's warm, put it on level 1, give her 2.
Hey, stay with me.
You find the source?
No head, neck, or torso trauma. Belly distended but soft.
That's not an intestine.
It's an umbilical cord. This kid just delivered a baby.
What do you mean, just?
Maybe 5 minutes ago.
She's still bleeding, clamp?
Where did you deliver this baby?
Hey, what happened to your baby? Hey, sir? Sir, you're the one who brought the girl in, yeah?
She gonna be okay?
Yeah, she's fine. Where'd you find her?
About 2 blocks that way.
Okay, can you show me? Okay. Hey, grab an OB kit and follow us.
Got it.
She was right there.
Okay.
What are we looking for?
Sexton!
She just abandoned the thing?
April! Full syringe. Come on. Come on. Okay. Blanket. Oxygen. Down.
I'll take him to the NICU.
I'll take it.
Hello, Erica. I'm Dr. Manning.
When can I leave?
Based on how much blood you lost and what your body's gone through, I'd say you're at least here overnight. Is there anyone I can call? Your mother or father?
No.
Maybe a friend?
Did they find the backpack?
Yes. How did you end up in that alley, Erica? Why did you leave your baby there?
I don't know. I mean, I knew something was going on inside me, but I figured if I could just not think about it, then maybe... I'm so stupid. I'm so happy that somebody found him.
Erica, honey. How old are you?
14. If there is someone you can call.
She's 14 years old. A kid. She's scared, alone.
What about the family?
Her mother's in prison, father's long gone. She does have an older sister living in Champaign, though. I left a message. Here's the thing. She was 2 blocks away. 2 blocks. I mean, maybe she was trying to make it here.
Is that what she said?
She clamped the umbilical cord. She did not mean to harm that baby.
Right, put him in a backpack, leave him in an alley. That'll keep him safe.
It's not that cut and dry. She was delirious.
She left her baby to die. It's exactly that cut and dry.
She's a child. She wasn't ready for any of this, right?
People come here for help. I try to leave my feelings out of it.
Well, that's convenient. But you don't understand because you're not a woman.
Don't give me that. People need to be held accountable regardless of sex.
This is a safe haven. She could have dropped the baby off, no questions asked.
So now you do have feelings? She's got to live with this for the rest of her life. Do we really want to punish her as well?
You're talking as if there's a happy ending where that baby survives.
That baby is going to survive.
And if he doesn't, then what that girl did is murder. How are you gonna feel then?
How many pads did she soak?
A dozen or more.
She must still have retained products. Which attending did this?
They're busy, I did it. You did it.
All right. Page OB, let's get her up to the OR now.
Got it. Yep, get me OB.
How many units has she gotten?
6.
Her most recent hemoglobin?
5.9.
She still looks like a ghost. She needs more blood. Restart the MTP.
Give me methogen and 1,000 mics of Cytotec. Little room.
Erica Doherty's been in the system for years. In and out of foster care since her mom was sent to Logan. Runs away when the families don't kick her out. Suspected substance abuse, at least alcohol, maybe worse.
Would you ask Dr. Manning to step in here, please? What about the baby's father?
Who knows? Erica's been arrested more than once for solicitation.
Miss Goodwin?
Yes, Dr. Manning, this is Madeline Gastern from the Department of Child and Family Services. What's the baby's condition?
He's stable.
And Miss Doherty?
Dr. Pachevsky's treating her. She may need a hysterectomy. I reached her older sister, Kara Doherty. She's on her way up from Champaign. Kara's an adult. Could she potentially take custody of Erica and the baby?
Potentially.
I know you always try to keep families intact.
Thank you, Dr. Manning.
This girl is in big trouble. She could be going to prison.
Come on. She's 14 years old. Solicitation or not, that's rape.
Doesn't absolve her. She's facing several potential felonies. Abandonment, attempted murder. It's up to the state's attorney and the judge, but Cook County, anything could happen.
Let's unclamp. Turn on the circuit.
ECMO acts as a heart-lung bypass, oxygenating the infant's blood outside its body.
Sats are rising.
Thank God.
Dr. Manning, there's a Kara Doherty downstairs to see you. Okay.
The police are on their way to talk to Erica Doherty.
Police?
That's the way it works.
What are they gonna do to her?
I don't know. It's not my call.
Can't you change this?
No, and neither can you.
Well, this should make you happy.
Listen. The hospital's only 2 blocks away.
What?
The police will be here soon. Tell them you knew the hospital was only 2 blocks away.
The cops are coming?
And tell them you clamped the umbilical cord. You wanted your baby to live.
Thirteen-year-old female, Michelle, worsened on the ride. This is her father.
Michelle, I'm Dr. Manning. I'm gonna take care of you. When did this start?
20 minutes ago.
Is she asthmatic?
No.
Bee sting something she ate?
Definitely not something she ate.
How can you be sure?
Because she never eats anything I don't prepare for her.
All right, we're gonna move her on my count. 1, 2, 3. Call respiratory for event stat and get a crash cart in here. Yes, Dr. Manning. She's in bronchospasm.
Breathe.
Drop 0.3 milligrams of epi, 1 in 1,000, and give it IM.
I'm not sure that's safe. She's on other medications.
What medications?
Metoprolol, Tegretol for her seizures, methadone for pain.
Methadone?
She has mitochondrial disease. It affects her body's ability
I'm familiar with mito.
Sats are dropping.
All right, we can't wait for respiratory. We need to intubate. Give me 20 of etomidate, 80 of sucks. She spasmed down. Where are the drugs?
I lost the IV. I'm trying again on this side.
We don't have time. We need to cric her.
All right, I need a tray
Give
in
me
here.
a 10 cc syringe and 16 gauge needle now.
What is happening?
Sir, I need you to step out.
Don't tell me what to do. My daughter is dying and you're letting her.
Now.
Sir, step back.
No, look, it's all right, kiddo.
Needle now.
Here, doctor.
Go ahead and hang another liter. Stand by.
I'm okay. I'm okay.
Hold on.
I'm okay.
Sats are improving.
Let's get a face mask on her.
Yes, doctor.
Oh, thank God you pulled out of it.
Sorry I scared you, Dad. Are you okay?
Am I okay? Listen to you. Oh, you silly girl. Deep breaths. Deep breaths, deep breaths.
I've never seen someone improve like that so quick. You?
No. You had a G-tube implanted?
Helps with her nutrition. She's not the greatest eater. We IV her supplements and vitamins.
My smoothie.
And the,
Central line catheter is for all her meds.
She's good to go. You are a very brave girl.
Got that from her mother. My wife died 4 years ago, breast cancer.
I'm sorry.
Not long after that's when kiddo here started getting sick. Migraines, fatigue, IBS. For a while, I figured it was just part of the mourning process, but it kept happening. I got that. I took her to I don't know how many doctors. Nobody knew what was wrong. So I went online, found out about Mito.
You went online for that?
For the first time, what Michelle was going through finally made sense. Good news, we know what it is. Bad news, there's no cure. So we manage.
Okay. Well, I'd like to do a full workup before discharging her, see if we can find what caused those spasms. Could take a couple of hours. You guys okay with that?
Do what you do. We're old pros. Never leave home unprepared, just in case we end up in the hospital.
Hi, Michelle. How are you feeling? Well...
Not great, to be honest. I'm wondering if we should adjust her IV fluids.
Okay. Well, we'll look into that. This is Dr. Halstead. I've asked him to join us.
Thank you, by the way, for keeping such a detailed account of Michelle's history.
Sometimes it feels like a full-time job.
I bet. Well, we were looking over her records and didn't come across any results for a muscle biopsy. Do you know if one was ever performed?
No, we haven't done a biopsy.
Aha. I highly recommend one. It's really the only way to confirm a diagnosis of Mito.
Well, no. The doctor was concerned how Michelle would react to the anesthesia.
What's he talking about, Daddy?
Nothing, kiddo. Yeah, she should rest. I'll be right outside. Can we chat outside? What are you doing?
Just trying to confirm.
Michelle has Mito. If I wanted her retested, I'd ask. I came here because she was having trouble breathing, and this was the closest hospital. I didn't come here to debate her diagnosis.
We're just trying to find a way to help your daughter start feeling better.
No. Dr. Halstead thinks he knows better than her father.
I was not questioning.
Oh, the hell you weren't.
Daddy? My stomach.
Michelle, are you okay?
Pulse is strong.
Pupils are equal.
Ivy.
It's good.
April, ammonia ampule.
Got it.
Anything you need? Thanks, we got it.
We need to take a look at that hand.
Do something.
Dr. Halstead.
Thank you. Michelle? Okay, Michelle?
It's okay, kiddo. It's okay. I'm here. Daddy's right here.
Daddy!
You still want to convince yourselves there's nothing wrong with her?
That feel okay? Do you need anything?
No, water's fine.
Notice how normal she is with April. And then her dad walks in.
Hey, how you doing, kiddo?
Hanging in there.
And the smile disappears.
Hey, Dad. I can't hold that cup. Can you bring it?
Of course, sweetheart.
See, so before she's drinking on her own, and now all of a sudden she needs her dad's help. It's like she's instantly self-infantilizing.
Why would you do this?
Because I asked him to.
Without consulting me? This is my patient.
You know, I ought to haul your ass up in front of the ethics committee. This is an absolute violation of patient rights, and you know that.
I do, Sharon. But we could be looking at a case of medical child abuse here.
Child abuse? Mr. Jaffe is overbearing, but he's clearly not intending to hurt Michelle.
Of course not. He's trying to save her. But that's precisely why we would refer to this as a conversion disorder. My gut is telling me this entire relationship is driven by her being sick and him taking care of her.
I remember Dad got tickets to a play that day. Wicked.
Oh, my daughter wanted me to take her to that. Was it good?
I don't know, I never saw it. I went into my dad's room to see if he was ready, but he was looking at pictures of my mom and being sad, so I went back to my room.
Then what happened? I have got to confess, I am so jealous of those socks. Those hedgehogs are fantastic. Okay, so you went back to your room and...
Oh, I just waited for a long time. And then my stomach started to hurt. And I got dizzy, and I yelled out for my dad, and then...
And he came?
Yeah, he came. He picked me up and took me to the hospital. Since then, it's been like this a lot.
And how's your dad been doing? Does he still get sad?
Not so much. I guess I keep him pretty busy.
Makes sense. So, we good?
We should be all set.
Thank you, Mr. Joffrey. Now, if you can sign just 3 more forms, promise you'll be done.
Dr. Manning's been down in radiology with my daughter for over an hour.
Would you like me to page her?
No. I'll just go down there.
Oh, I'm sorry. You can't be in the room while your daughter's having an MRI.
Yeah, that's what she said, but I'm not waiting around anymore.
Mr. Jaffe, I'm Dr. Charles. Can I talk to you for a second?
Yeah, why?
Well, it's about your daughter. There's a consultation room right over here if you had a couple minutes.
No, you know what? If you have something to say, can you just say it?
There is a strong possibility that your daughter's medical issues have a psychological component to them.
What the hell are you talking about?
It's very important that you understand that I wouldn't be telling you this unless I perceived significant risk to both you and your daughter. But I want you to consider the possibility that when your wife died, your daughter might have misunderstood your attempts to protect her from your grief, her isolation.
Wait, what? So I've been making her sick? That's what you're accusing me of?
It's much more complicated than that.
No, but it's my fault. I'm to blame.
It's actually not what I'm saying if you'd hear me out.
I cannot believe you people. I am not going to stand here and listen to this. I'm going to get my daughter and get her out of here. Michelle? Excuse me. My daughter's having an MRI. Where is that?
Right over there, sir.
Where's my daughter?
She's still in the MRI machine.
Well, turn it off.
Well,
I'm taking her home now.
I'm sorry, sir, but we can't do that. No, please, Mr. Jaffe. Please, Mr. Jaffe.
Open this door.
Please, Mr. Jaffe.
Open this door!
Mr. Jaffe, Madeline Gastern. We are from the Department of Child and Family Services.
What the hell is going on here?
A charge of medical child abuse has been brought against you by this hospital.
Child abuse?
That is a legal term only, Mr.
Michelle will be
Jaffe.
taken into custody by the state while the charge is investigated.
What are you talking about?
I'm sorry. I know this must be confusing, but we need to sit down with you and explain why this has happened.
You set this up, didn't you?
No.
Shame on you.
Mr. Jaffe.
You stay away from me. Let me tell you something. You people have picked the wrong battle.
So it's pretty clear what bones in the wrist are affected, but what I'm actually curious about is this. This is a previous fracture, one that's already healed.
Really?
Yeah, I don't remember seeing it in Beau's history.
Hey, sorry. Got here as soon as I could. How's Beau?
His wrist got broken, Daddy.
I'm afraid your son's gonna need surgery.
Oh, God, you hurt yourself pretty good, huh, big guy? Dr. Manning was just showing me Beau's x-ray. It appears that he's broken his arm before and we didn't realize it. Oh. Well, that must have been from last year when he fell down the stairs. He hardly complained. We just thought it was a sprain. Remember that?
Uh-huh. Poor Beau. Beau's hand is cold.
Griffin, don't touch your brother's hand.
Aaron.
Sorry, I don't want him making it worse.
It is cold. The capillary refill's delayed.
Wait, what does that mean?
He's losing circulation, not enough blood flow. April, call the OR. Tell him we're on our way up right now.
Got it. Christy.
Excuse me.
Hi. Dr. Manning, how's Beau?
Are they still operating on him?
Last we heard, he's doing very well. You must be Griffin.
Yes, sir.
I'm Dr. Charles. Nice to meet you.
Nice to meet you, too.
As soon as Beau moves up to the ICU, we'll let you know.
When he comes home, I'm going to take care of him.
Griffin.
Miss Taylor, Dr. Manning told me that you burned your hand. Would you like us to redress that while you're here?
No. It's fine. It's practically healed.
Mommy's clumsy.
Is there a reason you're here, doctor?
Well, waiting for a child to come out of surgery, that's a stressful time for any family. And we'd like to make ourselves available for questions, concerns.
I thought you just said the surgery was going well.
It is.
So why would we need to talk to anyone?
Aaron,
Well, can't you see what this is? This phony concern for your hand?
Is Daddy in trouble again, Mommy?
No, honey.
Doctor, let's step outside.
Can I come with you?
You stay here, Griffin. I'm not stupid. I've been waiting for this. You think I abused my family?
We do have a couple of questions.
I didn't touch my boy or my wife. And if you think I did, that's fine. You call family services, call the police, have them give me a lie detector test. I don't care. Now, if you'll excuse me.
What do you think?
I don't know. I mean, something's off, right?
I think so.
Let's call his bluff.
I've spoken to the Department of Child and Family Services. They'll be here in an hour.
Thank you.
Chest tube train now, 36 French.
Got it.
Gown.
Here you go. Hand me the travel shears. Here you go. Airway clear. Dr. Halstead,
Thank you.
Get the floor back. Set up for suction.
Coming through.
I've got it now. Suction's prepped. Stand by.
We need more sponges.
Yes, doctor. More 4x4s.
She tore something major in there.
Transfuses here.
Hook it up, start with blood in the plasma.
Got it. Starting now.
All right, we need some more lap sponge in here.
We're going up to the OR now.
Yep.
Hi, Dr. Charles.
Hey, Griffin. Where are your parents?
Dad went to get some pop. Mom had to go to the bathroom.
Oh. What'd you find?
Nothing.
I thought I saw you pick something up.
Oh, a button. It's that lady's.
Oh, the one who got hurt.
Uh-huh.
Yeah. What you gonna do with it?
Give it to the nurse so the lady can get it back. I'm not in trouble, am I?
No. But you know what? Let's find Mom and Dad. It's kind of a scary place.
I'm not scared.
No?
I want to be a doctor.
Really? Why's that?
The knives.
What?
To help people.
There you are, honey. I told you to stay put. I got bored. Okay, come on, let's go.
So it's not the father?
In my opinion, no. I think the father, very possibly both parents, are protecting Griffin.
A sociopath, really? He's just a little boy. He's only 10.
Sociopathic traits are identifiable in very young children, infants even.
But couldn't the picking up of the button just be a normal curiosity?
Most children, when confronted with such a horrific event, would be repelled. I mean, they'd be frightened, upset. He was drawn to it. And then to focus on an object instead of the person who had been so terribly injured, I think that Griffin's a danger to that boy. The whole family. I mean, the burn on a mother's arm, what's that about?
Okay, so what can we do?
Very little. We informed DCFS of Dr. Charles's opinion. If they deem Griffin a threat to his brother and his parents, they'll recommend removing him from the house. But it's only a recommendation. They can't force the issue. The parents have to take that step.
Mr. Taylor, I don't believe that you are an abuser. But I do think that you are covering up for one. Your son, Griffin.
That's ridiculous.
We're concerned for Bo's safety.
And yours, frankly.
We're talking about a little boy here.
Who has been exhibiting some very serious antisocial behavior.
Look, you just met our son. You can judge him like that?
I would love to be wrong about this. And you should have Griffin thoroughly evaluated. But if indeed we're talking about psychopathy here...
Psychopathy.
He's still young. His brain is still developing. There are very real things we can do to intervene and help him. Behavioral therapy has shown...
We're not listening to any more of this, Nedra.
I recommend you do. Because if you don't, ultimately, Griffin may have to be removed from your home.
No.
Let's go.
Wait. Where's Griffin?
Griffin?
What did you do? Nothing! Blood pressure spiking, heart's racing.
Get away from your brother.
I didn't do anything! Oh, God, sweetie, it's okay. Mommy's here. Mommy's here. Mommy's here. Heart rate, BP's coming down. What's happening to Bo?
He's terrified. The fear response is an involuntary reflex. Even though he's heavily medicated, he's aware he's in danger.
Sweet boy. My poor boy.
Mrs. Taylor. Mrs. Taylor, you know you have a problem. Please let us help your family.
DCFS recommended that Griffin be separated from the family.
Good.
No, the Taylors aren't going to do it.
What? I don't understand. They saw.
Heart will not accept what the eye can see. Willful blindness, right? I'm afraid this is not going to end well.
I wish we could have done more, Dr. Manning.
Yeah.